Good afternoon. I'm Terry Scoggin, the Chief Executive Officer of Titus Regional Medical Center. Today's Friday, October 15th, 2021. It's time for our COVID-19 update and our Titus Regional Community Update as well. Took a week off last week and traveled to Dallas with the family on Friday. Back this week and wanted to just give an update of where we are with COVID and some other things. Last Friday, while we were out of town, a very sad thing happened in this community, and we lost a good friend with the passing of Dr. Ted Trimble. Dr. Trimble is a family practice doctor in Dangerfield and has been in Northeast Texas for quite a few years. Has been a foundation in this area. Dr. Trimble was killed in an accident last Friday, and we want just to reach out and just make sure the family, his wife Gretchen, and the family, his team in Dangerfield, and most importantly, his patients, understand that we are praying for them during this time. Dr. Trimble was a tall, big man if you've never met him, and I enjoyed our times to sit down and have lunch. Had a lot of wisdom, and it was a very strong biblical background, and loved to sing, and just listen to his knowledge of medicine. If you have a chance, look on our Facebook and look at his obituary and just see what he did during his career, during his family. He's been a very successful person in a lot of things, and he believed in helping all of God's children, and he will be missed. And I regret not making more trips to the Dangerfield area to spend time and just to get wisdom from Dr. Trimble. But on the behalf of Titus, our board of managers, and our team, we just want to let Ms. Gretchen and the family know that we're praying for them during this time. And his service will be tomorrow in Pittsburgh at 2 o'clock. If you can just take a few minutes and just say a little prayer for the family during this time. With the passing of Dr. Trimble, he supported Morris County. We are going to open the clinic on Monday and start the family practice this Monday with Autumn Graham, a nurse practitioner here at Titus, who will be serving the Morris County area. Autumn has been serving in primary care for quite a few years in Northeast Texas. She has been with Titus since 2014, 2015, and recently was promoted to a nurse practitioner position in 2020. Over COVID, or during COVID, Autumn has been a superstar, and the team that she works with, the Family Care Center first floor, has seen hundreds and hundreds, almost thousands of patients over this last year in treating COVID, and she has saved many lives for the work she's done. Autumn lives in the Hugh Springs, Dangerfield area, knows Morris County very well. We're excited that Autumn has accepted this challenge to try and continue the mission of Dr. Trimble in that area to improve healthcare in Morris County. And we look forward to working with her as she opens her practice on Monday. Last Saturday, I want to say thank you to everybody involved in the Tennyson Health Fair, to the pastor and the church members and all the volunteers from NTCC, Titus Regional, and several other groups that were there last week. It was a good turnout. And for COVID and for what we're going through right now, some was outside, some was inside. We social distance. Was very appreciative of our cardiovascular physicians, Dr. Abbas and Dr. Siegel, and Dr. Siegel's wife, Dr. Siegel, as she was there helping out as well, doing some cardiovascular testing and getting some great tests in the community. So we were excited about that. We gave flu shots out, we gave vaccines, and just gave, more importantly and most importantly, a lot of knowledge on healthcare. So thanks to everyone involved. We appreciate Tennyson on an annual basis going above and beyond to partner with us related to improving the lives of this community. Bingo for Bags is coming up, and we're going to do something a little different this year. Last year we did not do Bingo for Bags, and we're going to bring it back in a couple weeks on October 26th. It will be half capacity, so there's only 200 tickets for sale. So if you're interested in going to this event, they're going to spread out the tables and fewer people at tables, and we'll be wearing masks that night. But it is for awareness of cancer research and Paint the Town Pink, one of those activities for the month of October. But if you haven't bought your tickets, please go to Facebook. Tickets are going fast for it because we only have half the capacity. It is a fun night, and I know my family enjoys going every year to all the activities. On October 30th, we also have a recreational shooting. Dr. Beauvais is doing field trauma and rescue course. And Dr. Jim Beauvais did this a couple months ago, almost a year ago now. But it's a pretty impressive class. If you have hunters in your family or, college age or older children from that who go out and hunt quite a bit, this course is for an accident that happens in the field. And they're going to spend a few hours that day talking about, what do you do in the situation if somebody's shot? It's not just a safety course on guns. It's more into what do you do in case of this. EMS will be joining Dr. Beauvais that day. And I will tell you, we had almost 30 people attend the class last year, and the reviews were blown away by the individuals who do either hunting or shooting competitions, that they came here and got a cool packet of things to take with them in case of an emergency. So look forward to that. I also want to thank Mount Pleasant ISD today for the opportunity for our team to go over to the high school yesterday to meet with the Mount Pleasant HOSA, both the juniors and seniors, who will be coming back on campus this year. Be a little bit in limited areas because of COVID. We won't allow them to go in all the areas of the hospital, but we're excited to have our students come back to Titus Regional. And what they're doing in Mount Pleasant ISD and the surrounding high schools is just impressive. Our goal is to provide for these schools opportunities for the students to learn about healthcare so we can keep them here, so they can stay here at Titus in Mount Pleasant and move on as nurses, as lab, imaging, physicians, all types of positions in the hospital. So thank you for the opportunity yesterday or Wednesday to go meet with those students and just talk to them about the hospital and prepare them for being on there. Some of you will see them when you become patients over the next few weeks and months of this school year. So as we get into COVID and talk about the fourth surge, we're consistently seeing the decrease, not only in Northeast Texas, but across the state. And it's a consistent decrease. We haven't seen a plateau yet. I just got off a phone call with the Texas Hospital Association and Dr. Hellestat giving an update of the different regions, and most of the regions are consistent right now. They are seeing a decrease, consistently seeing the numbers. At Titus today, we have 9 patients in the hospital. It is not the lowest we've had, but it's the lowest that we've had on the COVID floor. So 9 COVID patients in total. Our ICU patients have picked up. And that's the concerning thing that I just want to continue to reinforce, is we've probably hit our lowest number of COVID patients, non-ICU, that we've had in the last 2.5 months. But our ICU numbers are staying consistently high compared just to the other ones. So even though we are seeing that decrease, we are seeing some very sick people who are coming into the health system and still have the inability to transfer many patients. So beds and ICU beds are still at risk. So I would encourage you and just beg of you, if you do show symptoms or are concerned about exposure, make sure you get to the family care center or your primary care physician, get tested, and try and get on this as quick as possible. The Regeneron treatments are out there. If you have COVID and qualify for that Regeneron treatment, we're seeing that decrease and getting really sick. So with the increase in ICU patients that we have and the sickness of some of the patients we're still seeing in the area, this still is something we have to be worried about. So just want to make sure that we reemphasize that. You can see our numbers in Northeast Texas continue to go down, but the ICU patients have stayed almost flat. They did drop from 40 to 37 yesterday, but you can see in that 40 to range from there. The ICU patients, they're still there, so we're still seeing some sick patients. I did not get the Tyler information today. The map was kind of not really something that you would want to show from there. But from a Dallas perspective, you can see the same thing. A little bit more of a decrease in the ICU patients last week over this week, but over the last few days, you can sit there and say it's been pretty consistent, dropping to 530. But we're going to continue to watch it. I don't think we're out of the woods yet. It's something that we'll continue to watch. From a vaccine standpoint, we continue to push, and I'll move my elbow a little bit or go this way a little bit on from a Titus perspective. But you can see from our region, we're at 49% first dose with 42, still way below the state's number of 72% first dose and 63% fully vaccinated. From a Northeast Texas perspective, our Titus County perspective, we're almost 53% one dose eligible. And our first dose, our fully vaccinated, as you can see, is numbers right, 43, almost 44%, which is above the region as well. So we're continuing to push in this area. We still have our vaccine clinic open at the Medical Plaza. We still encourage you, if you've not gotten your vaccine, even if you have COVID in the past, we would encourage you to consider the vaccine. Moderna and Pfizer, we have both of them right now. The boosters is what we're waiting for right now, just of what our next steps are going to be. Pfizer has been approved for booster shots, and we are offering the Pfizer booster at the vaccine clinic. Moderna is in the final stages of being approved. Yesterday, CDC made some recommendations. We're expecting the state to bless it over the weekend and early next week, and we'll offer the Moderna booster for anyone who qualifies, and there's some certain qualifications that we'll put out there online, and they'll have that at the vaccine clinic as well. We're also waiting over the next few weeks to see the release of Pfizer for more pediatric cases. 12 to 17 are okay for Pfizer vaccine right now. We're expecting in the next 2 to 3 weeks that the CDC and FDA to approve Pfizer for 5 years old to 12 years old. We'll be meeting with the pediatric clinic and other physicians over the next few weeks to understand what that process is and how that will look here at Titus as we go through that as well. Again, I just want to thank you for your support of our health system. I want to thank you for your support of Titus Regional. We continue to ask you to pray. Pray for Dr. Trimble's family, his patients, but also pray for the individuals that we have in our ICU. We're still fighting the disease. It's still in this area, even though every day we're seeing more positive things come about from COVID-19. Thank you for your support of the health system. God bless.